All right. Good morning, everyone. On behalf of Lorraine and myself, we'd like to share with you some of the thoughts we've been putting together on investing in early childhood. And we titled our paper, A Road Less Traveled, because we truly want to understand why we're not seeing this transition. So when we look at the goal of this forum, which is investing in young children globally, what we found was that the young children piece we were all really familiar with, and most of us in our sleep could recite what it means when we talk about early childhood and the ages and the domains and the definitions. So we sort of put that aside. And then we said globally, that was another piece we put aside because we truly understood if you really wanted to talk about sort of global issues, how would they come together? So the part of the paradigm, or sort of this whole title that we were most puzzled with and felt we really needed to know more about was investment and investing. And when we started to think about this, we sort of started to see a temporal relevance between investment and early childhood, because they're both about the future. There is a time continuum to the payoff on investment as there is on the child to adult development trajectory. Investment is about transferring today's purchasing power to the future with an expectation of positive returns. And early childhood is about the foundation for human and social evolution with inclusive and economic social payback. Investment is about the current value of a product or expenditure in a system that both will sustain and improve future business. And early childhood is about human capabilities that have the potential to improve capacities, achievement, development, and individual freedom, thereby improving society. So there were a lot of these temporal similarities that were starting to come together in our thinking. Yet, we really couldn't unpack this term investment beyond that. So we wanted to put sort of some signposts or guideposts. So through this paper, we're going to play with the metaphor of a road and of traveling. And we wanted to put out these sort of 4 guideposts that may help us chart our path. And in those 4 guideposts, we wanted to understand what is this word investment when we look at it with reference to early childhood. Who are the early childhood investors? Why do or don't they invest? And what kind of investment tools do we have right now that we know about? And I would submit to you that both of us have come to this presentation with a great deal of humility and diffidence, because we realize that there is a tremendous journey and learning that has to take place. So what we want to do today is just share a few illustrative ideas and thoughts. And the goal of this session actually is to get your feedback, your input, your analysis to really enrich our broader community understanding of investment. So Lorraine and I are very sincerely looking for some very, very sort of your insights on this as we share some of these ideas just to stimulate thinking. So we took this model and we said there are these 4 pathways we're going to look at. What we're going to do is the colored arrows sort of point out to maybe some areas we know about, but then the gray areas are the ones where we have a lot of questions and we don't quite know which direction we're going to go in. And we're going to play with each of these 4 questions and each of these 4 quadrants on our path, on our road from investment to early childhood. So the first sort of area we look at is what is investment when it comes to early childhood? And in our reading of the work, the bottom line is investment is a commitment. It's a commitment most frequently made that the expectation there will be a profitable return or payoff. So basically, it's about making choices on a set of assets to form the portfolio of investment. When we started to look at all the factors that influence this construction of the portfolio, we found that there is an exhaustive number. We don't go into all of them, but we just look at a few that we think link to early childhood. The first is, what is the goal of the investment? And when we look in the area of social investment, we find that these are traditionally linked to improving conditions in society. And there were a set of criteria there that really struck us as being relevant to early childhood. The criteria that guide this are efficiency, justice, and sustainability. Some of the principles that came out of the Huck presentation as well. And that is, investment should be well allocated, distributed across the population, and to a scale it can be sustained. The second element that goes into creating a portfolio for investment is the timeline for the payoff. In some instances, it's a short-term gain. In others, it's much longer. What we found was short-term payoffs find more traction amongst investors compared to long-term gains, as investors are prompted by more immediate and visible returns that feed into these short-term funding and result cycles. Yet the longer-term payoffs are the ones that we really look at in early childhood, and they're more difficult to raise funds for. And so we started to see already a timeline issue coming up with this creation of the portfolio. The third factor, which was very interesting, was the assessment of risk, because risk is a big element that is taken into consideration while creating this investment portfolio. We found the simple definition of risk to be very easy, which is it compromises profitability of investment. But when we started to unpack that and look at all the risk factors that range from socio-political instability, inadequate institutional infrastructures, population demographics, religion, culture, legal and regulatory frameworks, some of which came up earlier too, we start to see these risk factors are interacting with each other, and these sources of risk start to get quite complex. We also noted that risk is not always negative. If managed well, it can have a benefit on investment. So in this creation of the portfolio, these were ideas that have started to emerge that we need to consider as we create this case for investment. There were, as I said, the gray arrows really tell us that there's a lot that we don't know in this area. One is looking at the commoditization of holistic early childhood programming. Where do we really understand that in a way, because investment is a lot linked with commodity and products. Given the variation in program models, how does that relate to investment? Some of that came up yesterday too. Are we talking about investments in programs or provisions and the demarcation around that? And how does a range of interventions impact child outcomes? So we started to see that these different interventions have a different way of looking at outcomes. Again, some of it came up in our panels yesterday. So sort of where we are right now is at the very initial part of this journey, and we still have a lot of unknowns. We think that if we get the unknowns, we will start moving towards this. For those of you who are following this little diagram, I want you to keep focusing on the square in the middle, because there are changes that occur to that. I just want to make sure everyone's with me, because the energy level seems a little low in the room. Is this all good? Do you see the money pile growing? Okay, because I'm not getting much feedback, so I'm just trying to pick up on the energy here. When I was teaching, sorry to digress, I know I'm eating up my time. Okay, no, I won't digress, I'll focus on this. Okay, so the next area is, who are these investors? Who are the people with the money? Okay, and again in the review of the literature, they sort of fall into three areas: public, private, and civil society. Public funding is really about funds that come from government or large national sources, and that was covered a lot yesterday and again today. And traditionally, we see it around health and education, some degree social protection and justice. So I'm not going to go into that. What I am very intrigued by, and the literature was quite exciting, was this whole area of private funding. In private funding, we start to see many different groups. We start to see the beneficiaries or the families who are spending money by user fees, paying for the programs. Then we start to see charitable giving as an area of investment for children. However, at times, through the emerging research, we found that this investment may be considered a double-edged sword. Funding with the donor appeal of some forms of care may counter the evidence, yet attract high contributions, and perversely perpetuate such provision. One notable example was the funding from charitable giving to orphanages and institutional care, and you can see where that storyline may be going. The third group in the private sort of big area were businesses that are starting to recognize the importance of ECD investments. Private businesses that are owned and controlled by individuals and groups and not by the government. The interest of the private or commercial sector in ECD appears to be twofold, and I think Nidhi was alluding to that yesterday in her comment. There is a need for increasingly educated and a healthy population that can serve the competitive workforce, and there's a desire to fuel a sustainable long-term economic growth that can provide businesses a market to sell goods and services for the future. So in the private, there's a lot going on there. And then we looked at sort of the big bucket of civil society. Again, there are many investors in there. International NGOs, development agencies, and donors. We see across the 193 countries that we looked at, early childhood programs implemented by many NGOs, Save the Children, International, World Vision, Plan, Step by Step. We see a whole bunch of foundations, Aga Khan Foundation, Bernard Van Leer Foundation, some newer foundations, Hilton, H&M Conscious Foundation, and then we see development agencies, UNICEF, World Bank. So there's a whole group in there. And while we were thinking of these groups of investors as discrete categories, in reality it's seldom the situation. The public-private partnerships are growing, and the relationships between investors is starting to change. As Sherry showed us yesterday through her presentation, this catalytic role of investors is starting to emerge as a function of generating greater funding for ECD. So then we started to understand, what do we need to know? And as this businesses are growing and other sectors are growing in this, and given the dynamic nature of the relationships between investors, we really need to do a much better mapping of understanding who are the investors and how do they relate to each other. The one part in the literature which was not clear and we couldn't get a good handle on is, how does demand for ECD transform in the investor profile? What is happening in the demand for early childhood that is bringing different investors in, and who are they? There is something dynamic going on there, and it's alluded to in the literature, but it's not very tangible. We couldn't quite grapple with it. We have to learn more about public-private partnerships. That train has left the station, and we've got to understand how they can be used for early childhood, and we have to track these good investment pathways. So again, going back to the drawing board, we have some broad understanding, but again, there are areas that still need to be answered, and if we do, the money pile grows. Did everyone notice that little animation? I'm very excited about these little things, you can see. Okay, all right. So now we come to, why do or don't organizations, communities, and families invest in early childhood? And I think the bottom line across the literature is that investment is about values. It's really about what you're willing to put money into. And what we found here in this sort of conversation was, one was the willingness to pay, where individuals are willing to pay a price based on the market value they attach to the benefit. So for example, the willingness to pay for a glass of milk is based on the benefit it will gain the individual, and what the individual may have to give up for that glass of milk. While this example is tangible, willingness to pay is not an actual payment per se. It's a value decision that benefits the investor. The other value assessment is around competing priorities. And we started to talk about this yesterday as well. The benefits of investing in early childhood are often compared with competing demands on the same source of funding that also demonstrates a good return. This process of priority setting is driven by values. When competing priorities and comparing returns or even risk is challenging, because different services and goods monetize different outcomes. So we start to see, after the value-based work, it becomes a strong technical exercise. For investors whose priority is children, assessing returns on outcomes is easier. For investors whose priority is economic growth, monetizing outcomes like the ones we value, psychosocial skills, can be challenging. Furthermore, the long-term perspective, which we came up in the first paradigm, for the long-term perspective and the existence of the number of externalities makes this accurate estimation challenging. The third area is limited costing information, and Tamar's session really covered this well, because ultimately investment is distilled to a basic equation of benefits exceeding costs. That means we have to have the fundamental knowledge about costs. The problem that was highlighted yesterday was costs for ECD fall into many buckets. It's multi-sectoral, it's hard to calculate. But the other issue I really want to flag here is estimating the cost of quality. So for example, if we look at a key ingredient of quality, it's the interaction between the adult and the child. We know from the child development literature, it is that interaction that makes the most difference. So that means now we have to start somehow calculating that. Work by Jan and his colleagues have shown that staff salaries are often the largest cost category for an early childhood program. And yesterday, Maria Vittoria presented to us her costing tool, which was very innovative because it was linking costing to the outcomes of learning. So I think we really need to understand this cost analysis to be able to come to why do or don't investors pay. What we were most intrigued by was this lethargy between what people should do and what they do investment. So there's a lot of should, there's not a lot of action. Why is that? Why cannot we close that gap? That value decision, why can't we have a way to understand that? We also don't know what are the competing priorities and how they are costed. So if we had to make an investment case, we don't quite know how to put them against each other. As is highlighted yesterday, we don't quite have the systems for collecting costing data. And I think we really don't know what types of market failures are leading to this under-provision of ECD. Households don't know and appreciate the magnitude of benefits or the positive externalities, or the benefits of early childhood are not quite captured by households. There's a lot going on in this sort of market failure area that we don't have a good handle on and we need to understand. But if we do, we get greater investment. So then the last section we came to, the fourth guidepost, was what kind of investment tools are there right now? And given the sort of range of investment tools, we really wanted to link it to early childhood. And we realized that investment linked to early childhood, it's more than losing and making money. It's about creating change. So we wanted to look at investment tools that are also interested in making change, not just getting an economic payoff. And that's the area where the social investment tools really make a difference, because they demonstrate a shift from sort of the traditional grants on expectation of return with the goal of achieving sustainability. The one tool that wasn't talked about at all was microfinance in this meeting. And in our review, we found microfinance coming up as a tool that encompasses investment through financial services for small businesses and households. Returns are calculated across a range of outcomes, including poverty alleviation and financial inclusion. The tool that did get talked about a little bit yesterday was social impact bonds, as this tool for expanding investment in ECD that allows government to partner with private sector. Social impact bonds are a promising new financing mechanism that allows governments to pay only based on programs' performance against a desired pre-agreed set of outcomes for a target population, like reduction in stunting or infant mortality. What we, I think, need to explore a little more is, can social impact bonds be that sort of platform that Amarjeet talked about, that focus on targeted outcomes and provide this bridge for interagency silos and prevent sort of these cooperation bottlenecks that agencies have. And this is something that social impact bonds is looking into, which we found quite fascinating. So we really also need to understand more about the investment tools. I just highlighted a few. We don't know very much about what early childhood outcomes are applicable for calculating returns. There is a lot of perverse incentives that come into place when you start putting them in. Already we are seeing that with the assessment of, let's say, malnutrition and healthy children when their ratings are done. And given the important role of community in both early childhood and investment, I don't think we've done a good job of harnessing that nexus, and can we do more with it? So again, if we really start looking at that closely, we will start to see a greater investment. Our bottom line on this paper was that the field has been really talking about ECD investment for a couple of decades now, but it hasn't been translated into this financial investment growth. And we were looking at why. And our review suggests the following. The picture is hopeful because opportunities do exist. However, at the end of the day, investment is a statement of values and setting priorities. And somehow through our review, we didn't find early childhood to be a major priority for public, private, or civil society investment. This road is not traveled because I would attest, we really haven't understood how to increase the value of early childhood for investors. We have not been successful in translating evidence into what will be valued. We have failed in making a compelling case. And I think the onus and responsibility is on us to change this, to translate this, and put forth a compelling case to this group of investors so that we truly start to see these investment gains for early childhood. Thank you. Okay. I tend to talk all the time, so I'm going to give them
all the difficult questions. So we are looking for inspiration, questions, interrogation. Lucy?
Thank you for a brilliant joint presentation. Can I ask about commodification? And this is something that, coming from the world of HIV, has been very much an issue in thinking about both the evidence and the advocacy, which is that in HIV we really realized that the provision of essential services, for us it was ART and medical services, was something that we had to fight for against a very strong push from both the private sector and the research sector to commodify, to make profitable. And I wonder whether there were any thoughts from yourselves or from the audience about how we can avoid that potential in this sector. It's harder in a way because we don't have the same affected advocacy group who can have a strong voice. We don't have the strong adult educated voice of MSM to push for the rights of free services. And it certainly doesn't mean that you shouldn't have services which people can pay for if they choose to, but that no one who can't afford to should be denied services. I'd really value thoughts on this.
Thank you for a very interesting presentation. By way of a comment, not so much a question, and especially in the road less traveled, I think one element which I thought needed to be addressed is governments. You did have a slide on public systems, and the reason why I raised this, because I think the issue, you said it in your concluding remark, that perhaps our ability to convey the evidence, there has been some limitation with that. I think that's really the core of the challenge, because across countries, a lot of the investment decisions, especially when public funding is involved, is your ability to convey to the political leaders what is it that is important. Because I, for one, do believe that if it is conveyed in the appropriate way, there is buy-in. It is not that political leaders would like people to live in misery all the time. I think that's the first point I'd like to make, that a lot more needs to be done about trying to convey the evidence in a manner that it is demystified. What is happening is that the failures of the school system across many countries in the world, the scenario of high enrollment but low performance is something which is challenging many countries. And I think one of the fallouts of that is to look at governance deficits more closely. The other is to look at nutrition deficits more closely. And I think, on the one hand, the case for ECD is coming through the failure of the school system, which is not the best way to do it, but that's really the fact. The other, as I see in public finance, at a time when democratization of societies and other issues have created a sentiment for entitlements of people, the ability of the states to invest more is a little limited because of certain sluggishness in the economic performance. So I think the challenge is, on the one hand, the case is being made for entitlement-based allocation of resources for human development. On the other, the ability of public funding to meet the aspiration. Now this is where the point that Eduardo raised in the context of Brazil, it becomes extremely important how well we are able to convey that outlays are actually translating into outcomes. It is no longer the case that there is profligacy, I spend 10% of the GDP, what if I fail? No. The time has come where every pie has to be giving results in some form. And that's why I think Subrat, when he was making the presentation, we need to move on to the next level of analysis. Allocations, yes, but allocative efficiency. How is that Tamil Nadu did well with that same resource and say UP did not? Or what are the linkages of financing and performance, efficiency, effectiveness, whole lot of those issues. So I would say that how to get public systems to invest more by getting the evidence across in a manner that the priorities are well understood is really the biggest challenge. Thank you.
Larry, and then we'll try some answers.
I would love to hear at some point thoughts from our forum colleagues, Raquel Bernal, Florencia Lopez-Bu, and Quentin, economists' thoughts about your presentation. So I invite those present and absent to do so. Because I find myself thinking like an economist momentarily, which means I probably need medicine. And a couple of quick thoughts. One is, from my point of view, your presentation helps me think about how relatively underdeveloped the conversation has been over the last 2 days about the role of parents in investments. I am quite sure that if priced right, if costed right, parents and families make the dramatically greatest investment in children globally, everywhere. And that leads one to think about freeing parents from constraints to invest in children more. So I personally don't think that government expenditure policy should all go to providing services, although some of those do free parents. I think they should also go to freeing parents in fundamental ways. Time, as well as, you need a pile of clocks as well as a pile of dough in the middle of the figure. And the last is that in terms of efficiencies, the huge advances being made in the combined psychology and economy field of behavioral economics, I think, should be something we bring to bear systematically on this. The ways in which programs and systems can become more efficient and effective through harnessing information about the burdens, the constraints that parents experience and caregivers experience is another big dimension to flesh this kind of stuff out in.
Okay, We'll try and give some. I've got some off the hoof kind of comments on those questions, and then we'll try and take let Pierre comment and take some more. The commodification one is most interesting in terms of making it profitable, but I think we also have a tension between doing it for profit as being a motivator on the one hand, or doing it because it's right being another motivator, and what of those two are the biggest triggers for funding. Your point about government is really very interesting, because we know from experience that we can either say there's an evidence gap and we need to get evidence, or, and in this field it is much more of the latter, we have evidence but it's not heeded. And that's actually a more difficult question. The academics are very good at getting evidence, but we really need a whole set of different skills to say, well, we have this evidence, why is it not heeded? And I think that there's sort of two failures, one of which was picked up yesterday, that the more the private sector and the charitable sector and the civil society take on the burden, the less the government is bullied or pushed or feels a guilty conscience to contribute. So we have this kind of sliding scale. So instead of everybody getting involved, we have this kind of competing, which becomes a cycle of error. And another point that I just believe, and I don't know there's great evidence, is that because this is so important, and it's about Larry's point about parenting and this time, we tend to gravitate downwards in the skills. So this use or overuse of unqualified or volunteer people or lowly qualified people means that those people don't have the political muscle to stand up. And, you know, so if you have a health problem, you've got doctors and surgeons who are going to stand up and shout. If you have an issue like HIV, where you've got a very educated consumer voice who can stand up and shout. But in this area, your recipients are young children with no voice, and the providers are parents who are so busy providing for their kids, they haven't got the time or energy to shout. Or the staff who really are not sitting at the decision-making table.
Lorraine, thanks for those. I probably, I think, Lucy, you're right. Just trying to figure out what's the threshold between making it a product that investors can invest in and avoiding it becoming a commodity that then has some sort of fees and levies associated with it. It's really a question, and we couldn't quite find. Why? Should I shout? No, okay. So that was one. Amarjit, we have to tweet your statement, public funding to meet aspiration is where we need to go with the conveying of the evidence. And I think some of the points you brought out in terms of failure of school, the governance aspects really fall into that bucket of risk factors that we read about in terms of infrastructure that we need to take into our assessment of creating this investment portfolio. I probably won't answer Larry's question since it was addressed to Quinton, other than to say I should have mentioned in the introduction the caveat to this paper is we realized there are multiple types of investments, but for the ease of getting started, we only looked at financial. But your recommendation is well taken that we shouldn't pretend to be economists, and we won't. So we turn this over to Quinton, who can give you the proper answers to your questions. Or we should take the happy pills to make us economists. Absolutely. So, Quentin is going to answer. Oh, she's calling. It's time. Okay, quick, please answer. Yes.
Can we beg a moment for Quinton?
Well, I can tell you what I think about or what I need. So we actually just finished a portfolio review of what we did at the World Bank over the last 12 years, and so we can claim victory. We increased quite a bit funding for ECD over the last few years. We have a few cases of good practice, things that worked well and so on. What I don't have, what my colleagues don't have and ask repeatedly is how do I have some kind of diagnostic tool that tells me where at the margin I should invest more. Right? That's the practical question that we have. I've heard a lot about increasing levels of spending and so on, and on a broad point of view, of course, I do agree in many cases, probably also for India, but that's not the practical question. The practical question is where, at the margin, can I reallocate funds or spend what I have to have the largest impact, and how does that depend on the very specific outcomes and context of a country. None of what we did in the forum addresses that to some extent, neither in this workshop, neither in the previous workshop, and that's normal and that's fine, because it's a very difficult question. But if there is one thing that this forum helps us think through, it is, to me, that diagnostic tool, because then my colleagues who are working with country governments can use it, and governments can use it, right? I mean, that's the practical question that we actually have to answer from my point of view in this forum, where, depending on country characteristics, depending on the level of achievements in various areas of ECD, depending on the likely additional funding that could be there, where do we invest it to get the maximum outcome? That's it.
Okay, sadly we're out of time for this sort of formal interaction, but not for the informal with coffee. So seriously, with a very genuine appeal to please bring your comments and questions to us. We are very desirous of getting your reaction to these initial thoughts we put out. Thank you so much for being so engaged, and as your treat, you have coffee and tea outside.